My name is Amit and I'm from Smart Medical Bio. And what a day it is to try and draw parallels between two of our generation's deadliest diseases. One that has killed millions of people over the last couple of decades, and another that just came last year and has obliterated the entire world. I am obviously talking about asthma and COVID-19. And how ironical would it be if the medication for one could actually try and cure the other? You want to know more? Stay tuned. Hi, welcome back. Now before we go ahead, let's understand something very carefully. What is asthma? Asthma affects our lungs' airways by creating inflammation inside our lungs' small airway, thereby not allowing air to pass through and creating what we call an asthma attack. Now it happens through various triggers like dust, stress, pollen and a lot more. The most common medication for asthma are inhalers, which provide by transmitting the required medicines to our airways, thus reducing inflammation and providing immediate relief. So now there are two kinds of inhalers which we need to understand. First is beta agnostics, which basically provides an immediate relief, however is not a great long-term solution because it does not treat the problem at its source. The second are called corticosteroids. Now these are more long-term solution for the problem where it treats the inner lining of the airways, thereby making them less susceptible to these triggers, and that over a period obviously reduces the chances of you having an asthma attack, and hence it is considered to be a more kind of long-term and a more approved way of treating asthma for the longer run. Now ever since COVID-19 came into the picture, we have been fighting tooth and nail trying to figure out a way to control its spread. And not just that, alongside this we have been trying and kind of experimenting with a lot of other drugs which could reduce the symptoms of COVID-19 and also obviously try and reduce the death rates that we have been seeing with the disease, but with little success. But that's just until now, because finally we have started to see some interesting results from the trials that has been conducted by the Oxford University over the use of corticosteroids in COVID-19 patients. Let's take a look. Now if I have to summarize this study, it would be something like this. People who took budesonide during the initial symptom stages of COVID-19 had a very reduced risk of being hospitalized at any point of time during their sickness, and had a reduced recovery time, which is the most interesting of them all, from COVID-19. So effectively the average that they figured was somewhere around 9 days for a patient who was going through a regular process, while somebody who had taken budesonide from when the initial symptoms occurred, that patient actually recovered within 7 to 8 days. So there was a good 1.5 day difference between the two averages, which is actually more interesting because it means that the drug actually in some way also reduces or rather treats the sickness in some way or the other. What exact way, none of us know yet, but at least the results say that there is some amount of difference. Now we must understand why is this happening and how does this medicine actually work. What this medicine does, as explained earlier, is that it allows the airways to remain broader, right? And what happens when the airways remain broader for a longer period? More oxygen goes in, right? And that's the problem that we have been facing. When a patient takes budesonide, their airways remain open for longer period, are less irritable. So instead of requiring pure oxygen, the regular air that our bodies actually inhale would be enough. And that can make a huge difference in the scenario that we have been seeing around us right now. Now, going back to the data, from the studies conducted so far, there has been a drop of about 75% in the number of patients that have gone ahead and become critically ill after being exposed to this drug. And additionally, there has been a drop of 15% in the recovery rate in the total number of days of these patients. These are great numbers to have. However, this is just a clinical trial. The drug hasn't been actively used in population yet. Now I understand this is exciting news. Finally, we have something that can be taken during the initial stages of COVID-19 and that can possibly keep us and our loved ones stable for a longer period without requiring them to go to hospital at any point during the entire COVID-19 period. On top of that, something like this, if it were to deliver the required results, this not only allows us to know that we and our loved ones are safer, but also immensely reduces the amount of pressure that our healthcare system has been under. Now, this is a widely available low price medicine that is relatively safe. However, as is the case with most medications, budesonide must not be taken without proper medical prescriptions. After all, it's a steroid that can have varying factors of long-term effects on our bodies. In terms of short-term effects, the short-term side effects include nasal irritation, sore throat, nausea, and certain other smaller kind of irritations that we have. Its long-term side effects on non-asthma patients are not yet known for obvious reasons. However, given the dire situation we currently find ourselves in, the Indian government has rightly allowed the usage of budesonide in mild COVID cases, and that should ideally, if the tests and its results are anything to go by, that should allow us to see a drop in the number of seriously ill patients of COVID-19 that we have been seeing for the past few weeks. So let's just stay indoors for a few more weeks and see if this cure works in real world situations, and if we might have found a vital weapon to fight this battle. So if you like this video, do press the like button below. If you would like to see more such content, press the subscribe button and press the bell icon so you know when we upload our next videos. So that's it from me this time. Stay home, stay safe.